A partial nail avulsion with phenolisation is a minor surgical procedure that is undertaken under local anaesthesia in order to cure well-established ingrowing toenails and involuted nails that persistently dig in along the edges of the nail. We are able to treat many ingrowing toenails effectively without having to undertake partial nail avulsions. However, where patients present with established ingrowing toenails, and particularly where there is granulation tissue and a history of repeated symptoms, then, providing the practitioner is experienced and proficient in the field of nail surgery, a partial nail avulsion is therefore a perfect cure. The procedure is quick, simple, and does not require stitches, and apart from the day of surgery will require no time off work or affect your normal daily activities. Since the procedure involves the removal of only a small section of the nail and the corresponding nail matrix, the cosmetic results are excellent. Prior to the procedure, the toe is numbed with local anaesthetic. This involves 2 injections at the base of the toe. However, before we inject the skin, we spray the skin with a very cold spray. The patient is completely unaware of the needle entering the skin, so people who are needle phobic need not to be too concerned. Once the toe has been numbed, the section of nail that requires removing is identified, and a tourniquet is applied to the toe. The skin adjacent to the nail is then separated from the nail, and a guillotine pair of nippers called Thwaites nippers are used to incise the nail Mosquito forceps are then used to peel the offending side of the nail away from the nail unit with the corresponding piece of nail matrix. This will expose the gap between the remaining part of the nail and the skin. The area is then cleaned, and the application of phenol will ensure that the section of nail that has been removed will not regrow, and therefore the ingrowing toenail can never reappear. Phenol is a fairly powerful caustic. However, in addition to destroying the area from which the nail matrix originates, phenol has styptic qualities. In other words, it reduces any bleeding and it acts as a very good antiseptic. There are very few bacteria that can survive in the presence of 80% phenol. So once the phenol has been abraded into the exposed nail bed and matrix area, the area is wiped again and the application of phenol is repeated. Once it's been repeated for a second time, the area is then irrigated with an antiseptic spray. The area is then dried, the tourniquet is then removed, thus allowing blood to flow back into the toe. And note that the wound does not bleed. The toe is then dressed, and the toe will be reviewed after 7 days, and we will provide all the dressing materials and antiseptic necessary for the patient to undertake their own dressings at home in between follow-up appointments.